privileged to be talking in front of this, I should say, very enthusiastic and serene audience. Just to make sort of some disclosures here, no conflict of interest, both as a surgeon and as a yoga teacher. I, of course, take the opportunity to pay tributes in regards to my yoga teachers with whom I have been associated, who gave me direction and insight into what consciousness is and how important is the mind in controlling our disease. Friends, I look at our evolutionary process as somewhat that is depicted on this photo. We are really turning into fat monsters, and that is rather unfortunate. If you look at this slide, this is basically data that was published in a very well-recognized Lancet journal in February of 2011, which talks about Australia as being the second heaviest continent in the world, only next to the American nations. The problem is quite acute, and if you look at this data, which is slightly difficult to read, but I'll sort of just read it out for you. It is from 2007, and the state is Queensland. And if you just looked at what is the disease burden associated with obesity, and you can see the first thing that comes to mind is diabetes, which is almost up to 64.2% association with obesity itself. So it is almost termed as by WHO as a diabesity epidemic, because the two are so intimately linked to each other. The weight of the problem is 62% of Australian adults are overweight, based on an article that came in The Age in February this year. 27% of Australians are morbidly obese, which is obesity associated with other morbidities. And what is most worrisome is 21% of our children are overweight, which doesn't tell very well. If you look at more concrete data, which was published in Obesity Surgery Journal about the projections, and if you see the solid line, do I have a pointer here? Yes. So the solid line reflects, this is year 2000, this is 2025, and if you see the number of morbidly obese patients, which is reflected in that solid line, it is proportionately going up to almost 35%. And accordingly, the normal weight patients are coming down. These are projections from 2000 to 2025. Obesity and its comorbidity, multi-system problem, affects multiple organ systems, but what I'm just going to be focusing on today and trying to correlate it with is the metabolic side of things and the impact on the mind, which is the psychological aspect, which is really reflected by anxiety, depression, poor body image, low self-esteem, which again translates to a morbidity in itself. The interesting thing on this atlas that you can see is a global projection for diabetes epidemic going from 2003 to 2025. And this is an atlas which has been generated by International Diabetes Federation, which is an international organization solely sort of focusing on diabetes and various aspects of its treatment and prevention. And if you can see, the Indian subcontinent has got a projected rise of 108% over that time frame. And I must say, I'm sorry to say, it's not just people living in that particular subcontinent, but even people of that genetic pool who may have migrated outside of the Indian subcontinent, which relates to quite a few of us who are here. In the Australian or the Oceanic region, 76% rise in the diabetic population over that period of time. These are all very worrisome figures, and we need to know the hard facts. Last year, over 4 million deaths were attributable to diabetes alone, accounting for up to 8% of global all-cause mortality in adults. Diabetes is intimately related to excess weight. We know it causes insulin resistance, which can be measured. And this is the geographical distribution in males and females. And we are, as I said, second from the top. What is metabolic syndrome? We've been hearing about it a lot. We've been talking about it.
Essentially what it constitutes is few defining criteria. But what is the key feature in metabolic syndrome is it is the abdominal girth, abdominal circumference, which is a measure of the individual's deranged metabolic profile, such as lipid profile, which is deranged triglycerides more than 150, HDL, which is the good cholesterol levels below 40 milligrams or 50 milligrams per deciliter for women, blood pressure, which is 130/85 or above, and a fasting glucose level of more than 6.1. Other terms have been used for this metabolic syndrome, but as I said, the key thing is the waist or the abdominal curve, which is 40 inches or above for men and 35 inches or above for women. What are the risk factors for obesity and type 2 diabetes? Of course, sedentary lifestyle, improper diet, and all of those things are very much contributory. Plus, besides that, type 2 diabetes, hypertension, cardiovascular disease. But what is more important is, as we have spoken about on several occasions, stress. We did hear Dr. Gangadhar and Dr. Rajendra talk about stress and what impact it has on the release of a variety of hormones that lead to breathing rate increase, pupils dilate, blood pressure which goes up and down, and the heart rate increases and the blood sugar level increases. This is all in the acute setting. It's a part of the fight or flight response, which is well known and has been well discussed. But when this acute episode starts to happen on a regular basis, it becomes into a chronic stress response. And that chronic stress response is something that leads to high sugar levels persistently, or hormones, or the stress hormones in the blood, which are constantly putting a stress, especially talking about diabetes, are constantly putting a stress on the beta cells of the pancreas, which leads to their burnout eventually. So stress is the biggest cause. This is just a report from Diabetes Australia's second quarterly report from last year, which spoke about anxiety and depression being independent risk factors for developing diabetes. And the corollary was that people with depression and other psychiatric illnesses are at a high risk of developing diabetic-related complications compared to the controls. Alcohol and smoking made it worse. Obesity and mental health. I was going through when I was preparing for this presentation. A recent study that was published in the Medical Journal of Australia, which spoke about prevalence of metabolic syndrome among Australians with severe mental illness. And this was a very good study, and what they found was that having a mental illness doubled your risk of developing metabolic syndrome. And that is something which is significant. Friends, it's not just the impact of, on the mind that obesity has got, it's also the economic aspect of it. This graph that you're seeing clearly reflects that as the BMI increases, the cost of any treatment increases in multiples. And that is what is being reflected over here by the cost of treatment in a BMI less than 25, 30 to 34, and how it is going up in multiples of 1, 3, and 5. So the global pandemic of diabetes is inclusive of soaring costs, shorter life expectancy, and a very poor quality of life. What do we do to it? For the management of both obesity and diabetes, a variety of modalities are being used these days. Diet, exercise, drugs, both oral medications, injectables, and surgery. But as Dr. Rajendra said this morning, and I still remember, these are acting on a physical level. We need something that acts on a higher level, which is where I think yoga has got a role. Let's have a little further look. This slide essentially talks about weight loss strategies and the long-term outcomes, because weight loss is certainly known to bring about a positive impact in type 2 diabetes and also metabolic control. And yoga has got the ability, but this was not studied in this article that was published in the New England Journal of Medicine in 2007. This this study clearly showed that diet, exercise, or drugs in various combinations had an initial impact, but that impact faded off if you followed the patients long enough. Surgery was the only clear outstander out of this. But even then, surgery is not something that can be offered to everyone. Just a bit of clarity on the definitions. Normal weight is BMI less than 20 to 25. Overweight is BMI from 25 to 30. Obese is more than 30 to 35. And morbidly obese is an individual that has got a BMI more than 35 with at least 2 comorbidities associated with obesity, or a BMI more than 40. There is a new term now after this, which is called super obese, which is BMI more than 50. And believe me, we are beginning to see more and more of them. Surgery or any other modality is trying to shift them back to this. Some of the common surgical procedures that we perform in order to achieve not just weight loss, but also achieve a better metabolic profile and more specifically improvement in diabetes is laparoscopic gastric banding, sleeve gastrectomy, and a gastric bypass. I must say that the term of weight loss surgery is now changed to metabolic surgery, because we are realizing weight or BMI alone is not a good indicator of the individual's risk of developing these problems. And that is where we are beginning to see more and more of this frame shift and with subsequent better understanding of the problem. Standards of medical care in diabetes published this report about the effectiveness of these weight loss surgical procedures in curing type 2 diabetes. We're talking about a cure where the individual does not need to take any tablets or medications or injections for their diabetes control. And the gastric bypass stood out to be one of the best procedures, showing 89% remission rate in these patients. This is just a slide which is a photo of one of my patients' diabetes control chart, which is the glucometer spits out an annual sort of 12-month chart of what your HbA1c levels are. Prior to surgery, if you can see over here, and sorry I don't have a marker to exactly point out, but prior to surgery, this patient had a sort of, her HbA1c and blood glucose levels they were all over the place, just like a zigzag thing going up and down. This is when she had a surgery in October of last year, and after that the HbA1c levels have almost stabilized. She's currently not on any medications, which is something which is unheard of, and she's experiencing a completely different quality of life. But what is the role of yoga with diabetes? Now, yoga, as we experienced this morning as well, is basically a combination, So essentially yoga constitutes 3 different, I should say, aspects: the asanas, pranayams, and dhyan or meditation. The asanas optimize the functioning of the body organs. Pranayam or the breath control exercises optimize the oxygen supply to the organs, which is providing adequate oxygenation and thus optimizing function. The dhyan or meditation is really a stress buster, which helps sort of cut off that vicious circle of acute stress then going into chronic stress. And this is where yoga has got a definite role to play. I refer to this study which was published in a well-recognized Indian journal of Association of Physicians of India, and which basically looked at implementing the following aspects of yoga to a group of or a cohort of diabetic patients in their institution. They introduced Yam, Niyam, Pratyahar, Dharana and Samadhi principles, and they developed a module which they implemented. onto their patients. And what they found was that these patients who were, I should say, separated and compared to the control reflected an improved glucose control tolerance, improved insulin sensitivity, reduction in waist circumference, reduction in LDL, and an increase in HDL levels, and also very importantly a decrease in body fat and increase in lean mass. This was another article that I found recently in a journal from the United States, which spoke about use of yoga as an adjuvant therapy after obesity surgery. Clearly, weight loss surgery, as I said, is not for everyone. What do you do in patients who either are not suitable or who fail weight loss surgery? And their study actually took into consideration a set program of yoga, implementation on these group of patients, and they found that it improved compliance with post-op instructions, and very importantly, it was very effective in patients who had eating disorders. I do like to reflect on the yogic concept of diet, because I'm a strong believer that, as they say, as you eat, so shall you become. Food has a very important impact on your mind. Sattvic foods are the foods which have a calming effect on your mind. Rajasic are the ones which basically stimulate the mind, which are very excessively spicy, very hot, very, full of different strong pungent flavors. And tamasic foods are the ones that make you dull, lazy. Alcohol, drugs, or even foods for that matter that are stale, that have been frozen for an extended period of time, are in that different mode. Vegetarian diet is a diet which does not involve violence towards animals. We talk about animal rights, but at the same time we maintain huge slaughterhouses. It's a bit of a hypocritic, statement. From a purely medical perspective, high fiber content in a vegetarian diet reduces cholesterol, it increases insulin sensitivity, and of course it supports, lends support to the theory of non-violence. Eat to live, not live to eat. I refer also to this Medical Journal of Australia supplement that came specifically on the question that is vegetarian diet adequate? And this is, I've got a scanned copy of this, and I'm very happy to email it to anyone who's interested. And it recognized vegetarianism in the modern society and the futility of a violent, a non-vegetarian. I thank you for your patience, and I conclude my talk by saying that this quote from the Bhagavad Gita, which states that for the one who has conquered the mind is the best of friends. But for one who has failed to do so, his very mind will be his greatest enemy. Thank you so much.